Good evening, everyone. I hope everyone is doing good. Welcome back again. I'm so happy to see you again on a Sunday evening joining the mental health session. Thank you for all the excitement. I am Paridhi Jain and I'm co-founder of PRASHA. We have a very interesting session planned up for today. We have one session called Mental Health in Medical Practice with our speaker, Miss Aditi Jain, and a very interesting Q&A session where you can ask all of your questions and doubts regarding mental health with our speakers. So let's start the session. Forward to you, Aditi.
Can you all see me? Hear me?
Yes, it's clear.
Okay. Hello, everybody. There are 57 people with us right now. Should I wait for some more time?
I think people are joining, so I'll let them in and you can start the session.
All right, we'll wait for a while. Till then, I would like to ask if anybody of you would like to paraphrase or review whatever we learned yesterday and whatever you have picked from it. Dr. Rachna, can you please turn off your mic? Right, should I randomly pick somebody to paraphrase? Okay, is there something from yesterday that you didn't know already and you really liked it and would probably want to tell it to somebody else also? You can switch on your camera if you feel like it. Let's have a conversation for a while till everybody else is joining. Somebody's trying to speak. The co-founders of yesterday, what did you? Okay, I think Ebenisha is raising the hand. Tell me.
Right. Thank you very much for the opportunity. Yeah. So as for me, what came out yesterday, and there are two key things. The first one was about the first presenter. Yeah, which
Right.
was about that the healing power of the body, as in positive beliefs can heal the body, and also there are times where you have to believe in the medicine that you've been given for you to be healed, so to say. So
Absolutely.
to be healed. I think that's where now the the mind-body interaction comes in, and is it the biopsychosocial model, which entails that the body is, we are made up of psychological, social, as well as the biology part. So if one is not at peace, so to say, it means the whole health is in full. So the complete set of our well-being should comprise of the health biology, the health psychology, as well as the way we interact with others, the social part. Then from the second, I learned that it's not always that we have to really, you know, when you're trying to maybe convince a patient, I think there's one aspect that came out is the cultural aspect. Many are times
Right.
that overlook the cultural aspect. We just think of how things are run under normal circumstances without considering the cultures of our patients. Yeah, I think that's what I can say from yesterday's session. Thank you very much.
Absolutely. And there is a model in psychology which is known as diathesis stress model. Derek, we'll listen to you in a while. Just a second. Yeah, so I'm telling you about diathesis stress model, and it is basically about any form of illness. It can be mental, it can be physical, and the contributors to this particular illness are several. So for certain time being, the medical sciences were believing that if you are caught with a disease or something which is related to your body in itself, and it is not something caused by a virus or a bacteria or something, but something in your immune system that is wrong, maybe in your neurological system that is wrong, or you got a cancer or something like that. So till certain period it was believed that it is just the biology that is affected and that need to be healed. But after a point of time they've realized that there are several factors that plays a role, including your genetics, your physiology, your society, and of course your emotions. So that is what diathesis stress model is talking about, and this gave rise to a field in psychology plus medicine which is known as psychoneuroimmunology. That means how your psyche and your nervous system and your immune system are interconnected. So there are several like hell lot of common diseases which we think are because of physiology, but they have a direct relation with what we think. So, for example, your acidity, diabetes, and your stomach ulcers, heartburn, hypertension, all of these are related, directly related to the stress in your body. So that is how your psychology is connected with neurology and immunology. Somebody's mic is open. Please shut that off. And Derek was saying something, so we'll listen to you.
All right, thank you very much. One thing that came out for me was what Benesha what he has already said. The belief, what we believe in, and then the other important thing is the um, the effect we have, our attitude, how our attitude affects the outcome of a patient as doctors. Because we're not just people who patients should come in, they tell us a problem, then you give them this medicine will go and cure you, and it ends there. We have to listen to the patient, not only the disease that they have, but also we need to also understand how that disease affects their lifestyle, how it affects their day-to-day activities, so that we could know how we could help them. And also, according to the second presentation, the interaction with the patient will start from the time we meet the patient during the diagnosis, meaning when we tell them to say, this is what you have, it shouldn't just end there, because this patient, as technology has progressed, you find that even before they came to the hospital, they had Googled their symptoms. They had found out something there which made them to be never stressive. So when they come to the hospital, it should just end to say, no, you have diabetes, you have this, so you should be taking this, and it ends there. We should make them understand what that disease is and try to make sure that they understand. And the other thing I loved is about the communication with the patient. You have to communicate at a level where the patient understands, not trying to make yourself look as though you are more knowledgeable and all that. We have to make sure that when the patient comes to see you, the healing has to start when during the same time of diagnosis and interaction with the patient, not after we've given the patient the medicine. The patient has to believe to say, okay, what I've gone to have been helped before they even start taking the medicine. That can give them a positive impact on their life, and that can influence how they get healed. I think that is one thing that came out more. And the other part that came out is where I think somebody asked a question on when a patient is stubborn, when I have a stubborn patient, how you respond. I think I got that. It interested me because we have certain patients who come in with all sorts of anger, and if we take in to say, no, this patient has come with anger, and we think to say we are doing a favor to them, but they are coming with anger, it can't help us, because us, we're not there to compete with the patient or that. We have to understand why the patient is hungry. It could be that the patient has been in line for a very long period of time. The patient has been frustrated by the disease that they have. Or sometimes it could be that the condition that they have makes them to become frustrated and so on. So we have to find out more why the patient has that is acting like that, and try to help the patient and not try to compete with the patient or fight with the patient. Thank you very much.
Derek, you beautifully summarized what we have learned yesterday. And yes, I think there are 74 people that have joined. And you all are here on a Sunday evening. So I can assume none of you are partying today. Right, so let's just begin with the session. I think we shouldn't be waiting further. Okay, so our today's topic is more concerned with the mental health of you people as doctors, as counselors, as psychologists. If you pick psychiatry as your um, like master's degree after your MBBS. So this is for all of us comprehending how should we take care of ourselves and be aware and mindful about the mental health concerns of our patients. Now, these patients can be suffering from anything. It's not about any mental illness or physical illness. It can be anything, but we will look into the emotional, social, spiritual, and psychological aspects of all those diseases. Just a second. Can you see the PPT? Is it visible to you?
Yes, we can see it.
All right. So this session is the bigger umbrella of mental health in medical practice. And when I was preparing for this session, the most of the data that I found on mental health issues in the doctors were from the journals that have published most of the articles of American healthcare. And after a deep digging into the studies which are non-American, I have decided to compile the data which is from all over the world and not just American specific. The reason for that is because of the difference in the healthcare policies of America and the rest of the world, and also the individualistic culture that they have and rest of the world might not. So this is what I have kept in mind while preparing for this presentation. The agendas that we are looking forward to today are recognizing and addressing mental health issues among patients, strategies for self-care and mental well-being of medical professionals, and the third one, the role of psychology in promoting a holistic approach to patient care. This is something that we did a bit of yesterday also. Okay, so after going through all the studies, it has been found that if you compare all the professions, the rate of depression, the rate of chronic sadness, and the rate of uh, having a chronic stress and exhaustion was found more in medical professional and medical students in comparison to any other profession. So before going to what you people as doctors are feeling, let's have a look into what your patient might be going through. How would you connect to it, and how would you identify it as a medical professional? So this slide is about that there are many chronic illnesses which are physiological in nature, such as cancer, heart disease, diabetes and all, but they might develop, the patients might develop a post-traumatic reaction to it. Now, during these diseases, there may be a time when a client, in psychology, we call a patient as a client. We do not call a client as a patient. So, yes, let's refer to it either as client or patients. Yeah. So when a person is going through it, there may be a phase where the person is anxious about the treatment, may have trust issues with the treatment, may even not like the process of it, uh, might feel sad. This is natural. Okay, if you are going through something that is chronic enough, and if you're coming across things that are not in your favor, maybe you have lost a job because of a disease, you have an occupational difficulty, you have emotional difficulty. So if this exists till the span, the duration of the disease, it's still fine. But if it is prolonged, or if it is still persistent after the disease is over, or when the person is returning towards normalcy, there are definitely a chance of a person experiencing depression, PTSD, post traumatic stress disorder, where this anxiety, this sadness is continued. So I have mentioned most of the factors, which are also the symptoms that are mentioned in DSM and ICD. So DSM and ICD are the two manuals of diagnostic manuals of mental health disorders. ICD is for all other diseases too, but has a portion of mental health disorder too. ICD is issued by WHO and DSM is issued by APA, American Psychological Association. So after like intense research and everything, they have figured out all the symptoms of all the disorders. And these are the certain symptoms that are mentioned on the screen are of depression. So if you can see, there is persistent, sad and anxious and empty mood sort of feeling. There is hopelessness and pessimism. There is a feeling of irritability, loss of interest, decreased energy. So you may not know all these things during the interaction with your patient, because the patient is coming there for like a few minutes and you're meeting the patient for a few minutes itself. So how would you find out that a person is going through all of these things? There is mostly a person who's accompanied the patient. This person is the informant actually, maybe a father, mother, brother, husband, spouse, friend, or anybody who is accompanying the patient. So there is a possibility that if a person is going through, if the patient is going through depression or any sort of post-traumatic or post-illness syndrome, they will not themselves approach you and need to be taken to you by somebody who is related to them. So you need to look for all these signs if a person is feeling anything after the after or during the treatment. Now there are many assessments to actually find it. When you are maintaining a file for a patient which consists of all the data related to their illness, there are certain procedures which you can use, which are very much psychological in nature. The first and very important one is active observation, which includes active listening and active observation of non-verbal cues. Non-verbal cues, that means the things that are not said directly to you. You need to observe them in their sentences that are underlined, or that are said in between the lines, or they are expressing in form of certain story format. Even after observation, there is a informant that I've already told you. The informant is the person who would actively tell you about what the patient is going through. There is another very reliable way to do it, to maintain more data about this patient, and it is psychometric assessments. There are several assessments made related to the initial psychometric diagnosis. The famous one are GHQ, General Health Questionnaire. GHQ has a version which has 21 questions. What we psychologists refer to it as 21 items. So it has 21 items which are there to assess the general overall health of a person. It includes both physical and mental health. So you as a doctor and not as a psychiatrist or psychologist, can always run your patient through general health questionnaire. The the outcomes of that is divided among certain categories, which says that if the health is in the severe section or it is moderate, the person is feeling moderately low and all. If the situation is towards the severe side, or if the person is going through severe lows in their life post disease or during the treatment, you can always refer to that patient to a psychologist. Now, the psychologist would do a detailed MSE, which is also mental status examination. Now, mental status examination include all the things. It includes the genetic chart of that person. So there might be a possibility, something that I would like to explain it to you. You might have read about how certain diseases overtake which are present in the genetic makeup of a person, and that is also applicable to most of the psychological diseases also. So for example, let's take the global pandemic of depression, and I would like to inform you before going ahead that after HIV AIDS, which was the first global pandemic, it was depression that is the second global pandemic. So yes, when you take the mental status examination, you will find out about the genetic factors also, which, so you make a family chart of the person, pedigree chart that you call it. I'm sure that you guys have studied it already. And then you find out that who carried the genetic material for this particular psychological issue. Now, there is a possibility that that genetic factor was not even strong enough to show up in a person, but when a person went through a chronic illness, it showed after it. After so much of stressor, after so much of chronic pain and struggle, it overtook that person. So mental status examination identifies those entire thing. It also identifies that if a person is interested in grooming, eating, sleeping, and all the patterns related to it. There is something that I would like to add on in the observation part. You look for 2-3 major factors. The first is sleeping pattern, the eating pattern, and the social interaction. So if a person is sleeping excessively or not sleeping at all, eating excessively or have lost complete interest in eating, or the person is completely cut off from the society by himself. So you look for all these factors. So once you and your psychologist who have collectively worked and figure out that what is the real case, you referred the patient for palliative care counseling. Now, palliative care counseling was not in the medical practice before 1990, and after 1990, they have recognized the need for long-term psychological support to a patient. Now, there are times when somebody is going through a chronic illness, it is not just that the person is suffering, it is also the family members who are connected to that patient who are suffering too, and who somehow are also hopeless about life after certain illness. So palliative care counseling is for the patient and for the caretakers also. So the person who carries out palliative care counseling is mostly a psychologist or a counselor in the medical setup. And these are the people that there who make sure that there is a system for emotional support. There is active communication between the doctor patient, the caretaker patient, the patient, and the social support, that is the family, the surroundings, the neighbors, and everybody. Palliative care counselor is also responsible to help them deal with the stages of stages of how a person has to go through certain diseases and the outlook they need to have towards life after going through something like that. So they do the holistic assessment and they make a collaborative care planning along with the doctor, the psychologist, the patient, and their family. And that is how it is done. Now, there are studies that have found that if a person who has recovered from a chronic disease faced a relapse when the person was not given enough palliative care counseling in comparison to the people who were given follow-up support palliative care counseling after recovering from a chronic illness. So the relapse rate when you take care of the person this way is very low in comparison when you just give the person medications and let the person go. Disease is over, you go your home, I go mine. So that is what I'm trying to say, that as a doctor, it is your responsibility to make a surrounding and to make this a part of your medical practice to take care of a person in a way that the relapse rate is very low. So that's how you take care of a person and make your medical practice more reliable and more approachable in a way. Now, coming to the mental health of the doctors, there is an entire research on the burnout pandemic. Now this burnout epidemic is not about patients. It's not about the patient who are getting any burnout. It is about the doctors, the students who are who are facing burnout or mental or physical collapse, which is caused by overwork and overstress. Now, if you can see, I have mentioned a little chart next to the written material, and it talks about general adaptation syndrome, also known as GAS model, and this is identified by Hen Silek. Now, this person was a psychologist, and he identified, like, of course, this was a controlled research setup where he identified how our body reacts to a stressful situation. So he identified a common pattern that how and why the body is reacting to certain stress. Now, if you can see in the first phase where it is known as alarm reaction, when there is a stressor that occurs, for example, your exams are approaching. Okay, now this is just an example. I'll try to explain it to you in this manner. When your exams are approaching, you got your date sheet. Okay, and then your body is reacting to this stressor, to this how would you face the stressor. It is preparing itself. So the body is going into alarm reaction. It is suddenly aroused. It is suddenly trying to get ready for the to face the stressor. Now if you can see, there is a little loop from the line of normalcy. Now this is the time when we go in a downfall phase, we are suddenly panicked, and then we are thinking, okay, what to do, how to do, how many days are left, how much syllabus is there, how much I've already covered, how much I know by my heart already, and how much I need to learn. So this is the time when the person is in the low phase, deciding what to do, how to do. The next portion is where the body is resisting and is trying to cope up with the stressor. Now, let's say if you are employing your bodily resources, that means you have decided that you will study 8 hours a day, you will do revisions for 2 hours daily, and then you will start writing your answers, practicing that, so that whenever there is an exam, you're fully prepared for it. So this is what you are doing. You are using your bodily resources, your energy, your strength, your mental, physical load to deal with the syllabus. So your body is in the resistant state. And okay, let's consider a situation where the stressor is over. You went to give the exam went fine, you used the resources, and the exam went good. Now, this vary from person to person. Now, there may be a person who used the resistance of the body very nicely and takes the exam successfully. There may be another person who is in the same class, have to take the same exam, might feel the exhaustion stage, which is of the phase 3, where all your bodily resources are exhausted. And that is the time when your body starts feeling low, your mind starts feeling low. And if you can see in the phase 3, this line, this graph is going below the normalcy stage. Now that signifies that once these things, there are not enough resources, it's not that we are not facing the stressor, we still are facing the stressor, but in this stage, in the phase 3, we tend to catch illnesses. Now these illnesses can be in any form. As I've explained in the beginning, the acidity, the ulcers, the heartburn, hypertension, diabetes, all these are bodily reaction, including depression, obviously. So depression is the biggest state when you can't cope up with the stressors. That is the point where your body is on the decline. It's from the exhaustion stage and you can't face the stressor anymore. Now you will go to the exam, obviously, you will take the exam, but you might have noticed that there are many students who go to the exam and they say that I don't know, I forgot what I have learned, I could not recall what I studied during my preparation, and I was totally blank, I couldn't write anything. And that is the point where it is the classic example of how your bodily resources were exhausted enough and you felt so much of anxiety, so much of stress while writing the exam paper that you couldn't recall anything. So this model applies very nicely to any stresses that we are feeling in our life. It also correlates significantly to the medical education. And when you come into practice, the amount of load that you have as doctors is so significant that you might feel emotional exhaustion, depersonalization, that means losing a touch with your real self, or you might have a reduced sense of personal accomplishment. No matter how much you study, no matter how much you do anything, there you might find somebody who is better than you, and then you belittle yourself that I did not accomplish enough, I could not do enough. And that in itself is so much of exhaustion that you cannot deal with this stress anymore. Now there is a rise in this burnout cases. And now this rise is leading directly to certain reactions in your medical practice also. And there is a recorded data about the rise in medical errors, the rise in depression and suicides among doctors, and the adverse effect on the patient safety while performing your practice. So this is a classic case of all the countries. It is not specific to one country, or we're talking about American population or anything like that, but this is common to most of the colleges and most of the students. You might not be going with this. There are many of you who may be very excited about your medical education and are dealing with the stresses that are coming to you very effectively, but there are maybe some of you which are going through most of it. I got to know that there were students in Ukraine who had to come to Russia after the Russia-Ukraine war, and now they're continuing their education in Russia. Now you see, it's very easy for a layman to say that it's fine, you are shifted to another country and then you can carry on with your education. It's no big deal. But the changes that the person is going through while shifting from one place to another, picking the studies altogether from a new start, and then dealing with everything is so much of stress in itself. Like, most of you are staying away from homes. That in itself is a big stress. Managing your bills, managing your food, your classes, your marks, and the exam is a bigger stressor in itself, and then might lead to a lot of problems, which I'll ask you in a while. Now, there are two major causes of job burnout. That means medical job here. That is, I'm talking about. So there is a workload. There are a lot of cases, and if you consider countries like India, where the doctor-patient ratio is quite disbalanced, that means doctors per number of patients are very less. So a single doctor have to deal with a lot of patients. So there is obviously a workload. There is obviously physical demands, long hours of surgery, long hours of staying in the hospital, doing things and all. And there are also emotional demands. So these are your job demands, which are directly leading to exhaustion. Now there are job resources also, but if these job resources are lacking somewhere, for example, if you do not have enough social support, or if you do not have enough autonomy, that means independence to take your own decision, do your own thing, or you're not getting enough feedback or like bad feedback for your services, now these job resources are not ample for you to keep motivated, and they lead to cynicism and a feeling of low efficacy, feeling that you are not doing good enough, that you're not capable, and having a self doubt sort of situation. Feeling of like, you might have heard about imposter syndrome, where you think that no matter how much somebody say good about me, I'm not doing enough. Okay, so these are the things that lead to burnout. So low efficacy, exhaustion, these all are examples of burnout. It need not to be in a form of any physiological disease. It's not necessary. You get depression, or you feel um, gastrointestinal issue. It's not important. It's not necessary, I mean. But there are also psychological impacts that you may have as a result of severe persistence stress. And this stress is so much persistent because you are not going out of your job. Even your degree is like 5 6 years you have to tackle, and then your career is related to this chronic pressure itself. So there are a lot of self-care and well-being techniques which you practice yourself, or can refer to a trained professional, a psychologist, who might guide you how to go about things. Now, before going ahead, I would like to do a little bit of storytelling. So, a lot of people ask me that how do you identify that when you need to go to a psychologist, or how do you decide that it is the psychologist that you need. So when I asked this question to doctors, some of the doctors, They said we have enough knowledge already. Why would we go to the counselor? Why would we go to the psychologist? And the problem with this statement is in the thought process itself. Like if you see, considering that you know it all, considering that I am God and I do not need help of somebody else because I am the one who is helping others, is not harming to the other person. It is harming you only, right? So identify that you need a person. Now I like to quote this story when somebody asked me this question. So imagine you are going through a beautiful landscape of mountains and it is a empty road and you are driving your car and it's a very fancy car, you are enjoying the winds and everything. And let's say you are a doctor only or like anybody else, you are a musician for example. You are driving, it's fun, it's good, you are alone. You going on that road, stopping somewhere, eating things, and suddenly your car stops. It stops working. You don't know what to do about it. It broke down. You are a doctor, you are a musician, you are an artist. You have no idea how to do mechanics, right? You have a cell phone. You know this random guy from your town who works in repairing cycles, repairing cars and motors and stuff. You decide to make a call to that person. Now that person can only guide you, right? They can only tell you that you need to open the trunk and whatever that is engine and fix this wire, put it that way and fix that, check the tires, check gas, whatever. They can only guide you through it. You will be the one who will implement it on yourself, and then only your car can keep going. So if you, let's assume a time where you feel like, no, I got this degree, I to can fix the car anyway. So that won't work in your case because you don't know how to do it. So sometimes you need a person who can help you with you figuring out yourself how to go about my life, my journey from this point ahead. So there are a lot of techniques by which you can do that, which involve both the things. You consulting a psychologist or you figuring it out for yourself and taking some help and applying it on yourself and sticking to it. The first point of that is mental and emotional well-being. Whereas ma'am Ranjana ma'am said yesterday about mindfulness and meditation, where you take some time out for yourself, where you decide that after these many hours of practice, I'll sit by myself, sip some warm tea, and would cleanse my mind, would pick a hobby, would do meditation, would be aware about the present and stay in the present. You can always seek emotional support from your family members, your friends, your relatives, your better half, your boyfriend, your girlfriend. You can always seek that emotional support. If you are going through something sort of a downfall in your life, you can always have different perspective from the other person. The other one is the professional counseling. If you don't feel like opening up to different people, you can always open up to a counselor, talk about your life. There is always a clause of confidentiality. They will never break your trust. They will, like yourself, help you with with I said a term yesterday, that entire beneficence and non maleficence. That means doing no harm to you. There is something that is very important and which goes to all the professions, which is about work life balance. That is setting your boundaries, that how much you need to involve yourself in your work, in your patient. There are times that we are moved by a patient so much that we are so empathetic towards that patient that we start feeling it upon ourselves. There you will be coming across cases where somebody might have passed away, somebody might have gone through something, as a family is struggling, he himself is struggling with the disease and all, and you take it on yourself and it takes a lot out of your energy. It takes a lot out of your emotional strength and make you exhausted. So setting that boundaries, that how much you need, how much you want to let other people, other patients impact you, and how much would you as a person give time to the work and give time to your life. The breaks is the second thing that is very important. Taking short breaks, because breaks are the times which cuts off the fatigue, feeling derailment out of your life, out of your work, having a fatigue feeling. Taking breaks would definitely help it. Please plan a scheduled time off, even as a student also. Plan your weekends, go out sometimes, meet people, do work. It's maintain that work life balance together. Obviously, the third and the most important one is the stress management. Once you identify what is actually the stressor is, the thing that your body that your body is always all sorry that your body is already giving responses to, that it might be struggling with. So you identify those stressors, and that is the and after identifying the stressors, you apply your coping strategies. Now these coping strategies might be different from person to person. Some people are problem solving, kind of like they use problem solving as their coping strategies. Some people are emotional focused copers, so they use sharing their emotions, maybe writing something, venting out, crying. So these are the people who do emotional focus coping, listen to some music, transform themselves in that way. So you need to decide what is your coping strategy, along with time management. So if you manage your time, most of the stressors will be tackled with efficiently. You need not waste time as your resource. This time is also your resource. And if we keep on piling on things without managing the time, there obviously will be a state of exhaustion. The fourth most important factor is social connection. You all are living away from the house, maybe most of you. You maintain your relationship, use your peer support as a currency. We also call it as social capital. Like we all have financial capital, the things that we own, right? Property, money, bank accounts, anything. These are our financial capitals. We do not own other humans, but if we make good relations with them, we create our social capital. Now these are the people who would help, who would act as your peer support, who might even help with your other stressors. They might help you in dealing with those stressors. So maintaining a social capital, maintaining a peer support would definitely help with the dealing with this burnout situation. And join professional groups, something that I say to everybody else also, that while you are practicing as a professional in any field, specifically a field which is evolving day by day, like medical, like psychology, you in yourself might not have an idea with all the contemporary changes that are taking place. There may be times that when the things are coming all together on you, you might find it a big stress. But if you are in touch with other professionals, it eases down the load that is coming on you of knowledge, of evolving technologies, of evolving strategies. So joining a professional group would give you a sense of efficiency, as if you are developing in your own field and as if you are contributing to that field along with everybody else. So it is important to have a continuous learning and professional development. You stay informed, set your goals, set small goals initially, fulfill those goals step by step before jumping to a bigger goal. And you maintain a networking of professionals and of your social support. This is all that I wanted to cover in today's session. Right, you all can see me, right?
Yes, we can see you. Thank you so much, Aditi, for telling us so much information about the burnout and everything. I think it was very necessary.